Hi, welcome to Dental Canvas. I am Dr. Gopal Kasat, and in this episode, we are discussing the anatomy of maxillary central incisor. Before going ahead, if you are new to this series, refer to the link in the description or check the top right corner to know basic terminologies required for better understanding of this video. Now let's move ahead and start with the labial surface of the maxillary central incisor. Crown of the average central incisor is 10 to 11 mm long from the highest point on the cervical line to the lowest point on the incisal edge. Mesiodistal measurement is 8 to 9 mm wide at the contact areas, which lies in the incisal 1/3 of the crown. Contact points are defined by the crest of the curvature, that is, height of the contour. Mesiodistal measurement, where the root joins the crown, is 6 to 7 mm in width. Distal outline of the crown is more convex compared to the mesial outline, which in turn leads into rounded disto-incisal angle compared to mesio-incisal angle, which is sharp. Cervical outline of the crown follows a semicircular shape with the curvature root-wise. Now let's move on to the root. Root from the labial aspect is cone-shaped with relatively blunt apex and has a regular outline both mesially and distally, and length of the root is 12 to 14 mm. Now let's move on to the lingual aspect. Outline of the cervical line is similar with the curvature root-wise. Below the cervical line, there is a smooth convexity followed by a concavity which can be appreciated from mesial or distal side. The convexity in the cervical 1/3 is known as cingulum. The concavity is known as lingual fossa. Mesially and distally confluent with the cingulum are the marginal ridges, which outlines the lingual fossa. Incisally, the lingual fossa is lined by the incisal ridge, and cervically by cingulum. Crown and root both taper lingually, thus making mesiodistal width of labial side more than the lingual side. Cross section of the root at the cervix shows the root to be triangular with rounded angles. Mesial side of the triangle is slightly longer than the distal side. Now let's move on to the mesial side. The crown is triangular in shape or wedge shaped, with the base of the triangle at the cervix and the apex at the incisal angle. The labial outline of the crown from the crest of curvature to the incisal edge is slightly convex. The lingual outline is convex at the cervical 1/3, making cingulum, then concave, making the lingual fossa, and again slightly convex at the incisal edge. Labially and lingually, immediately coronal to the cervical line are the crest of curvature of these surfaces, giving it the greatest labiolingual measurement of 7 mm. Labiolingual measurement at the cervix is 6 mm. The cervical curvature of maxillary central incisor, that is 3.5 mm, is more than any other tooth in mouth, and the curvature is towards the incisal edge. The incisal ridge of the crown is in line with the center of the root. This is appreciated when a line is drawn through the center of the tooth from the mesial aspect. This alignment is characteristic of maxillary central and lateral incisor. Distal aspect gives the impression of somewhat thicker towards the incisal third when compared to the mesial side. This is because of the slope of the labial surface distolingually. Most of the teeth are turned distally to adapt to the dental arch. The curvature of cervical line outlining the cemento-enamel junction is 2.5 mm. In most of the teeth, distal curvature of cervical line is less than that of the mesial side. From the incisal aspect, incisal edge and incisal ridge with its slope towards the lingual side is seen clearly. Labial face of the crown is relatively broad and flat in comparison with the lingual surface. Lingual portion tapers lingually towards the cingulum. Cingulum of the crown makes the cervical portion of the lingual surface. This completes all the 5 surfaces of maxillary central incisor. To summarize it all, you can see a picture on the screen with all the average dimensions and key features. To download the same, check the description. If you have learned something, hit the like button and feel free to subscribe. Thanks for watching. I am Dr. Gopal and you have been watching Dental Canvas. See you all in the next one.